Okay, good day everyone. This is Dr. Homer Lim of the Concerned Doctors and Citizens of the Philippines. I'm also the medical director for the Akesis Holistic Health. For this short talk, I'll be discussing about the uh, vaccines as well as the seems to be an increased number of vaccine related injuries, no. We do see a lot of patients now after vaccination do complain of a significant number of injuries, though is it the same as in other countries? We don't have I guess we don't really have enough data on that kasi of course all these vaccines are still ongoing. So I just hope that yung mga vaccine related uh, injuries, whether it's vaccine related or not, I think we have to really be cautious and report if we need to. I think this is very important para alam natin kung talagang this vaccine is safe. Please remember everyone, no? All our vaccines right now are still in EUA, Emergency Use Authorization. Anong ibig sabihin nun? Ibig sabihin, emergency use. Not one of those vaccine has been approved by FDA. So therefore, these are all experimental. We are part of this, what we call great experiment. So I hope we submit data properly, especially those na bakunahan. If you have severe or moderately severe symptoms, if you have more than just the fever, the loss of, loss of appetite or less loss of parang manghihina kayo, if you have more than those symptoms and it's more than 1 day or 2 days, I think you have to report this para we can get a good data on vaccination. Okay, we are not anti vaccine. I think what is important though is we have to be truthful and factual with regards to reporting vaccines and vaccine related injuries. Funny that some organization came out with a data saying that we have zero deaths from vaccine. So parang I cannot, I mean, come on, let's be truthful that if you have zero vaccine death, okay, but how many people will really believe that, right? So I think we have to be honest. If there is truly vaccine related injuries or death, I think we have to be factual kasi we have to be honest with regards to this because this is this is for the public, for everyone. Already we have so many people who are quite afraid of the vaccines nga because of the what happened to our Dengbax episode, no. I think it put a lot of trauma in a lot of people. And when I say a lot of people, these are the people who were really affected. Yung mga nasa sadly, no, kasi yung mga batang nabigyan ng Dengbaxia were the children in in poor areas. So talagang makikita mo they saw it themselves. The kids were really got sick. Some of them really, in fact, some of them sadly they died. So I think this is one thing that we have to be more honest para we come up with the right figures. We should not be holding back or putting away vaccine related injuries as not related to the vaccine. If you would look po sa CDC, no, or in the United States, no, a American citizen, okay, if you have been vaccinated within the 3 years, 3 years, so 3 years from the vaccination, you can file for a injury compensation, no. So in fact, in Canada naman, anyone who has been vaccinated and then within the 42 days from the day of vaccination, it is it is categorized as probable vaccine related injury. So here in the Philippines, we are not so clear on the how many days are we supposed to say that a injury or an event, whether it's a stroke, a heart attack, blood clots, how many days from vaccination uh, should we say that it's really vaccine related or it's totally unrelated? So I think that is very, very important that we have to consider. A lot of people have been, putting up reports. In fact, there are so many Facebook page groups and Facebook posts on, probable uh, vaccine-related injuries. So I think we just have to be more transparent and more careful in saying whether this vaccine is safe or not, or whether these vaccine-related, whether these injuries are really vaccine-related or totally unrelated. I think we have to be more transparent. So I think that's what we want to say with regards to these vaccine-related injuries. No? We do see also a lot of people who have had infection, COVID, no, infection, and they were vaccinated. They actually had a more severe adverse events, and this has already been shown in studies, a UK study wherein they check. So those who were previously infected and they were vaccinated, they were more likely to have a more severe adverse reaction or more severe uh, side effects. Some of them, in fact, those who were vaccinated that had previous infection were more likely to be hospitalized because of these adverse reactions. So I think we have to be careful as to how we should give the vaccines, especially to those already who have had the infection. Uh, Wag natin ibaliwala kasi ang dami ko nang naging pasyente na who had been vaccinated and they already had the vaccine, I mean the infection, and then they were vaccinated. So especially if you just had the infection within the first 60 to 90 days kasi your immune antibodies is still very high, and if you take a vaccine, that your immune system will definitely go into hyperdrive. So we have to be careful with regards to vaccinating previously infected patients, no? In fact, sa mga trials natin ngayon, previously infected are not part of the protocol. So why are we adding one more component? Kasi it will only make things more difficult and more confusing to everyone, because you're not supposed to give the vaccine to previously infected because we don't really know. But now we know, because now we see that a lot of those who have been previously infected do get a severe form of adverse events. So I think we have to be careful. So if you have had an infection before, or you suspected that you have an infection, I think it's better either you do a antibody test. I know that some so-called expert say that you don't need to do antibody test, but I think just to be safe, why not? There's no uh, losing a few thousand is better than getting sick to the point that you have to go to the hospital, or you're too sick that you have to stay at home for the next 2 weeks, and even months, no? So I think we have to be more careful in giving vaccines, no? So to those who already been had COVID infection, please do talk to your doctor if you really want to do your vaccination. Okay. Thank you. This is Dr. Homerlin for the concerned doctors and citizens of the Philippines.